Module 2, Evidence-Based Health Policy. Now, when we're talking about evidence-based policy, we're talking about the use of current best evidence in making decisions about care communities, populations, in a number of ways. Basically, using scientific evidence, scientific knowledge that's been identified through research studies, whether qualitative or quantitative, in helping us identify not only the problem, but the best ways in which the problem can be addressed within a particular community or society. Now, why do we need to use evidence-based policy? Well, we want to be able to be sure that our plans will work. So that in order to say that if we want to address this particular health issue, we want to be able to say that based on these research studies, doing A will likely see a decrease in the problem. So you want to be able to have that level of surety. And again, why do we need to use this? By assuring people that if this policy is implemented, that it will work. And in doing so, increases the likelihood that people will actually use it. That people feel more confident in its utility. And again, why do we need to use it? Many times it all comes down to money, time, and effort. We want to be able to show that the time, money, and effort made in implementing a particular policy will work because we have the evidence to show that it will work. And so this helps improve the likelihood that a particular policy will be supported and implemented. Now, when we're talking about evidence, we're actually talking about information based on the level of bias. That is, to what extent is the information objective, or to what extent is the information subjective. Objective information is what we see in many scientific studies that seek to try to control for different factors, try to control for many types of biases, so that when we start looking at a particular relationship, we're assured that that relationship is reliable and valid. In comparison with subjective, we're seeing information that could be based upon many other different aspects, people's own belief systems, perhaps even a limited amount of information. But that's not to say that one in particular better or worse than the other. So we're not looking at objective being better than subjective, but it really comes down to is what question do you want to answer, and what kind of information is needed. We're looking at developing legislation limiting tobacco. We needed the information that was identified through many kinds of scientific studies linking the role tobacco and cigarette smoking has on many kinds of health outcomes, lung cancer and so forth. So through those kinds of studies that we're able to generate a large amount of objective information about the link that led to the growing support for that kind of legislation. But that's not to say that that's the only kind of information that's needed, that we can't make any kind of policy with anything less. Qualitative data many times is utilized to help us develop policies. And qualitative data will help us understand a particular community or a particular set of stakeholders in regards to a particular policy. So by generating qualitative data, we can understand whether a particular policy will be implemented or not, or will be supported or not by particular community members. And so that helps us again in how it's designed and implementation. And sometimes the problem begins with just learning about people's experience. That is, when we need to identify the problem, perhaps that first step is a person saying, hey, I have a problem with this. There is this situation. Which then you can then start building. And so each kind of evidence does have a role, and so should not be just dismissed. Now, if we're talking about evidence, we also need to talk about other kinds of information that could come into play. Evidence such as developed from the media. And the media may have certain information that could be usable. Again, if you're looking at the subjective range of information, we may be able to look at it in that way. But the media can maybe also be driven by any other factors, many of which may not be very truthful. Certain ideological biases within the media, certain um, uh, stakeholder issues may be driving a certain media point, and that will need to be addressed. We may also face pressure from certain political and social groups toward a particular issue, which may also drive the media as well, as you mentioned. But we're looking at certain groups, certain stakeholders may have a particular interest for or against a particular policy, and so that will create alternatives to what the evidence is saying. During the issue regarding the banning of tobacco in workplaces, there was a lot of activity by the tobacco companies in saying that was not a link uh, between tobacco and cancer, and so it was in their interest to, again, to pressure to promote that idea in the face of the growing interest because they didn't want those particular policies being implemented. And then we need to deal with the idea of history or the idea of inertia. Things that we've been doing things this way for so many years, why do we need to change? Many people, many communities, many societies, to a certain extent, are very change adverse. People don't like to change. And so trying to get people to think about changing their behavior in a certain way will require a lot of work and a lot of evidence. And so when we're talking about the kinds of evidence we use for making policy, our evidence will have to pretty much be in conflict with these other sources of information.